Hi everyone, welcome back to my channel Dr. Shahan's class, and here in this video I will tell you about glucagonoma. So what is this glucagonoma? This is a kind of condition you can see where you can find a rash, and this rash is reddish blistering rash. And what is the name of this rash? Necrolytic migratory erythema. Necrolytic migratory erythema. Basically, it is a erythematous rash. Erythema is there and it is migratory in nature and necrolytic in nature. So it is known as necrolytic migratory erythema. This is a special kind of rash. It is a blistering red rash that can be found in the condition known as glucagonoma. Now let us learn about glucagonoma. What is glucagonoma? Glucagonoma is a rare tumor and basically it occurs in the pancreas. Which cell of the pancreas? Which cell? Alpha cells. Alpha cells are involved. What is glucagon? Glucagon, you know, basically it is a hormone which is produced by pancreas, basically the alpha cells, and along with the insulin, this helps in regulation of the sugar in your blood. So glucagonoma produce what? Glucagon. Glucagonoma produce what? Glucagon. What is glucagonoma? The name itself says oma. Glucagon oma. Oma means tumor. Oma means tumor. So glucagonoma is a rare tumor that involves the pancreas, and this basically produce high amount of glucagon. It produces high levels of glucagon. And let us learn about other features of glucagonoma. Basically, glucagonoma is a tumor of islet of Langerhans alpha cells. Islet of Langerhans alpha cells of the pancreas. Alpha cells. Remember which cells? Alpha cells. It has been asked. Alpha cells. And which part of the pancreas is involved? The body of the pancreas and tail of the pancreas is involved. Both the body and tail of the pancreas is involved. And glucagonoma is 1% of neuroendocrine tumor. 1%. Remember, 1% of all neuroendocrine tumor is glucagonoma, and it involves what? Body and tail. And which part tumor? Islet of Langerhans alpha cells. And which age group it occurs? 55 years. Remember, 55 years. The mean age is 55 years. Another important feature of glucagonoma is nearly all are malignant. Remember, nearly all are malignant. That means it can spread to other tissue. And remember the rash. What is the name of the rash in glucagonoma? Migratory necrolytic erythema. What is the name of the rash? Migratory necrolytic erythema. Migratory necrolytic erythema. It is very, very important. It has been asked. What is the name of the rash? Migratory necrolytic erythema. It is found in glucagonoma. So it was a NEETPG question. Migratory necrolytic erythema can be found in glucagonoma. Migratory necrolytic erythema can be found in glucagonoma. And there are 4D symptoms. Remember, 4D symptoms. What are the 4D symptoms? Number one is dermatitis. I already told you the dermatic rash, that is the migratory necrolytic erythema. Another symptom is diabetes. These patients have high glucose, diabetes. Another is diarrhea. Another is diarrhea. Another is DVT. DVT is also there. So all these are featured. Remember, plasma glucagon is greater than 1000 pg per ml. This is the diagnostic. You can see this picture. This is the picture of the rash. This is the picture of the rash. I already told you rash will be there. That is known as migratory necrolytic erythema. Migratory necrolytic erythema. So you can see the rash. This rash is there. Along with this rash, remember, along with this rash, the patient will also have diabetes. The patient will also have diabetes and diarrhea will also be there. So remember that. Now let me tell you about the difference between glucagonoma and insulinoma. Glucagonoma and insulinoma, there is difference. What is the difference? Remember this. Insulinoma occurs where? In the beta cells. Insulinoma occurs, it is a tumor that occurs in the beta cells, and it secretes insulin. And glucagonoma, it is occurring in the alpha cells. So alpha cells, glucagonoma. This is the first difference. Both are occurring in the islet of Langerhans, but insulinoma occurs in the beta cells, glucagonoma occurring in the alpha cell. And what happens in glucagonoma? I already told you, diabetes, necrolytic migratory edema, the rash is there. DVT, that is deep vein thrombosis. Deep vein thrombosis is also there. But in case of insulinoma, what you get? Hypoglycemia. You get hypoglycemia, that is decreased amount of glucose in the blood. Hypoglycemia in insulinoma. And because of this hypoglycemia, what happens? Confusion. Because of this hypoglycemia in insulinoma, you get confusion, visual disturbance and diaphoresis. All this you will get in insulinoma. Remember, insulinoma is different from glucagonoma. Glucagonoma, 75% metastasis occurs, 75% incidence of metastasis, but insulinoma only 15%. Now look at this picture. This is the picture of the rash. I already told you the rash is very, very important. Migratory necrolytic erythema. Migratory necrolytic erythema. Look at this picture. This may come as a image based question. Nowadays image based questions are asking. So look at this X. They may give you this as migratory necrolytic erythema. This can be found in glucagonoma. Now let us understand what is the cause of glucagonoma. What is the cause? Is there any direct cause? No, there is no direct cause. There is no direct cause of glucagonoma. But if you have a family history of men type 1, if you have a family history of men type 1, then you have greater chance, greater risk of developing glucagonoma. So if you have a family history of men type, what is men? Men is multiple endocrine neoplasia. What is men? Multiple endocrine neoplasia. So if you have men type 1, then you have greater chance of developing glucagonoma. And how much percentage of glucagonoma is malignant? 75%. 75% of all the glucagonomas are malignant. So nearly all glucagonomas are malignant. Nearly all glucagonomas are malignant. And it can spread to where? It can spread to liver. It can spread to liver and other organs, remember. So this is another picture also showing you the rash, particular rash. Not only with this rash, the patient may present with diarrhea. The patient may comes along with this rash, diarrhea and diabetes. When you check the blood sugar, the patient may have high glucose because the diabetes condition is also there. So diabetes along with this rash, that is necrolytic migratory erythema, the patient may present to you. Now glucagonoma leads to diabetic like symptom. What is the symptoms? Glucagonoma leads to diabetes like symptoms. Diabetes like symptoms. So these patients will have similar symptoms like that of the diabetes patient. Similar symptoms like that of the diabetes patient. Like this patient will have high blood sugar. This patient will have high blood sugar. And this patient will have excessive thirst. Excessive hunger. The patient will just behave just like a diabetic patient. A diabetic patient have the polyphagia, you know, the diabetic patient has polyphagia, eats a lot, hungry, always hungry, excessive thirst, polydipsia, all these are present just like a diabetes patient. Now look at this, another feature, diarrhea. I already told you diarrhea is there. Along with that, dermatitis. I already told about the dermatitis, that is the skin rash which will be present on which portion? The skin rash will be present on the face, on the belly, on the buttocks of this patient. You can find the skin rash, and that is known as necrolytic migratory erythema. I already told you, migratory necrolytic erythema. And this skin rash, sometimes it is filled with pus. Sometimes it is filled with pus filled skin lesions. And remember, this patient may also present with unintentional weight loss and blood clots, that is DVT. Now remember these 4D symptoms. 4D symptoms of glucagonoma. I already told you 4D symptoms. It has been asked. Remember glucagonoma has 4D. What is the 4D? Diabetes. Number one is diabetes, hyperglycemia. Diabetes, hyperglycemia. Number two, dermatitis. Number two, dermatitis, the skin rash. There is the necrolytic migratory edema. Necrolytic migratory edema. DVT. This patient will also have DVT, deep vein thrombosis. This patient will also have DVT, deep vein thrombosis. And what is the last D? What is the last D? Depression, diarrhea. I already told you diarrhea, but remember another D can be depression. Another D can be depression. This patient can be depressed as well. So all these are the feature remember about glucagonoma. So this is me, and I have made this channel for helping MBBS students. So if you are a first year, second year, third year, fourth year, whichever year you are, if you are an Indian medical graduate or foreign medical graduate, please subscribe this channel. This channel contains so many medical videos. All are completely free for helping the MBBS students across the globe. So please subscribe this channel, and if you like this channel, please write down in the comment section below. If you have any suggestion also, you can write down, or if you want me to make a video on a particular topic, write down in the comment section. I will make a video on it. Thank you.